Hey, Dr. Lindsey and Wendy here. We're going to talk to you about a lady that's 13 months out from her hair transplant. And some of you guys may know I'm a little bit finicky about female hair surgery. The main issue being that women have to have enough donor hair to work with. And so this lady is a 60-ish year old college professor from out of state who had seen a couple of different guys, and we had done her niece, on whom we have a video. She's my skiing buddy from Utah. And this lady showed up, and this is what she looked like when she got here. And fortunately, Wendy, she had enough to work with, right?
Yes, so we do females, but everything they have to have at least some donor area. Most of the females that suffer from hair loss, they have nothing here and nothing to work with either.
Right, but luckily, look at the back of her head. Although it's fine hair, that's a mop of fine hair, and so we were able to get 2,300 grafts out of her without any trouble. And we put them in, and this is at the end of the case. And that's packed in there pretty good, right?
Yes, looks nice.
And as is typical, we never hear from these characters until I start hassling them about sending some pictures. And so she's, again, out of state, and I emailed her, and at 6 months, she looked like this. That's an oblique view that she took in the bathroom with her iPhone with indirect lighting. There's another one. And this is her from above. And then just compare that to her before, where she didn't have any hair. And it's only half grown at 6 months. And so she looked good. And once again, we didn't hear from her. And we were doing a video on some other females. And so I emailed her, and she was over in Lebanon. She travels to Lebanon frequently. And she sent these pictures back in just yesterday. This is now 13 months and a week or so out from her case, and she's taking these in her foyer with indirect lighting, and probably an iPhone or an Android phone. That looks great,
It looks really good.
And that's her from the front, and then she used a convex mirror, and you can kind of see the back of her head. We didn't do anything in the back. That white area that you see in her crown is actually her part line. She's got a light scalp, but that's a home run, don't you think, Wendy?
It does. It looks really good, and you can definitely see where we stopped. And the good thing with us is that we can always wear our hair long, comb it back.
Right.
Nobody can see it.
And I would really encourage all of you, if you're interested, to go look at the video of her surgeries. We filmed the whole case from start to end, and she talks about each part, including how she talked to a couple different doctors that seemed to paint a real rosy picture of sprinkling a few hairs and solving all the problems. And fortunately, she had second thoughts about the easy sounding thing and called us, and we also worked on her niece. So
yeah, I hear a lot from lots of females. They're like, oh, I'm doing the laser therapy, or I'm doing the shampoos and this and that. Nothing's happening. And then they start to look into a hair transplant. And at the end, if you have really bad donor area,
it's probably not worth doing.
No.
But if you have average or good donor hair, it's certainly worth coming in and letting us take a look at you. So
yeah.
if we can go ahead.
I said, yeah, don't spend much money on, just if you want to try something that is not surgery.
Probably Topic or Kabuki powder.
Topic and Kabuki, yes. That will definitely camouflage a bald spot. But lasers and shampoos, do your research and see if, really, really works.
Right. All right, so if we can help you, please give Wendy or me a call. Thanks.